Please welcome CNN MSNBC contributor and president of Kwame Inc., Kwame Jackson.
Good morning, Manova. Good morning. Let's lift this energy level. Good morning, good morning. You know, I know this is an amazing gathering of healthcare professionals and venture capitalists and thought leaders. I know they're really trying to push to make this the Super Bowl of healthcare, or in Minnesota terms, the Stanley Cup of medicine. And so I know this is an exciting gathering. I'm happy to be here with you today. Now, I have to raise my hand, and I'm sure like many of you say that my name is Kwame Jackson, and I am not a doctor, so raise your hand if you are not a doctor and you're here as well. I'm starting a not a doctor support group for people after this, so people can meet me in the Flamingo room. So essentially, today we're really focused on an amazing introduction of an amazing individual. I am the son of a doctor, but I am not a doctor. And so I grew up in a medical family with healthcare and understanding those issues, but really the why for me and what's pushing me to be here today is this notion of tolerance as a piece of your overall health and well-being. The notion of tolerance and accepting of people of all types of backgrounds. So, we have the world's preeminent thought leader in that space here with us today, Dr. Robert Brook. Dr. Robert Brook is trained from Johns Hopkins, where he holds 2 degrees. He spent almost over 20 years at the Rand Corporation as their distinguished healthcare chair. And he is the preeminent thought leader in healthcare and wellness, with overall emphasis on who you become from this notion of tolerance. Is it something that we should bring within the metric of how we think about healthcare? And so for me, what that means is tolerance is something that's very simple. Tolerance is simply affording every human being every right that you claim for yourself. Affording every human being every right that you claim for yourself. And that notion of that as a social piece of your well-being is important in healthcare. And I know this for a personal fact. As a leadership development strategist and a global traveler, I've had a chance to see that play out in 3 distinct entities. One, my time in Bosnia-Herzegovina. Just a few months ago, I was in Sarajevo, and I saw the legacy of the absence of tolerance. I saw bullet holes in buildings. I felt the weight of a war that's only 20 to 25 years removed. I felt Bosnians and Croats and Serbs still having that uneasy tension around how they coexist in the absence of tolerance. Second, I had a chance to visit a little island called Robben Island. Robben Island sits off the coast of Cape Town, and as we know, it's where Nelson Mandela spent almost 30 years in prison. I went into his cell, I saw the bars, I saw the rock pile that he had to bust up for almost 30 years that actually damaged his eyes, and I felt the weight of the absence of tolerance. So that's 2. And then third, I was most recently in Eastern Europe, in Poland in particular. And in Poland, I had a chance to visit Auschwitz-Birkenau. Now, that was a place where I truly felt the weight of evil, a true death factory. I saw ovens, I saw human hair piled up, I saw all of the indignities and the atrocities and the tragedies of the absence of tolerance and the effect on your social well-being. So if you think about when tolerance is removed from the human equation, Dr. Brook has become the leading voice, the thought leader in how we think about why tolerance plays a critical role in your physical, mental, and overall social well-being. So without further ado, I'd like to welcome to the stage Dr. Robert Brook. Does this do something? No. One second until there we are. All right, I'm going to talk to you about the future, but first I'm going to start in 2018. Imagine you're a pediatrician, you've just seen a 5-year-old boy, and the 5-year-old boy is pronounced perfectly healthy. His mother has left the room, and the boy turns to the pediatrician and said, "For my birthday, I got a toy gun, and I'm going to kill all blacks when I grow up."
is the child still healthy? Imagine you've just seen and delivered a woman with a normal delivery, the baby and mother are doing fine. You pronounce both healthy, and 6 months later, 20 people are dead in a suicide bomb. Imagine you're a Muslim physician at one of the leading academic institutions in this country, and the patient in front of all of the attendings comes to you and says, "Are you one of those? What do you do? How have you been trained? What is your response?" Now, in the year 2043, Manova will be 25 years old. All of you, I've seen most of you, will be alive. I think hopefully every one of you will be alive. Hopefully you'll all be back here. I will argue for this 20 minutes that the single most important thing that all of you can do is change the culture of medicine and public health to change the definition of health to include tolerance. And for us to go on record as saying you're not healthy if you're intolerant. And what I'm going to do for the next few minutes is talk about a variety of different things of why I think this is a crucial time in civilization to change medicine and public health to include this in the definition of health. Now, what would happen if aliens walked among us? What would they want to know about healthcare? Let's start simple. Let's say the space elevator is built in the year 2043. An alien rides it down, comes to the United States, gets allowed into the United States by immigration, is over 65, Medicare still exists, and she has to make a choice of which Medicare plan she wants to join. I don't know which of those fantasies you think is less likely or more likely to be around or to occur in the year 2043. It'd be interesting to know. But here's what the questions might be. How many people were served by a plan, health system, or doctor that I'm choosing? How many people died in the last week in that plan, doctors, or health system? How many deaths were preventable by better medical care of any type? How many deaths were good deaths if they were not preventable? You've heard discussions on all of these topics in this conference. What is sad is that after 50 years of health services research, we can't answer these questions. For a person over 65 that's trying to choose either a doctor, health system, plan, or anything else about healthcare at this moment. It is a shame. Is it because we don't want to do it, because we haven't put the money in to do it, or we don't care about other people because we think we can beat the system and find the best health plan, doctor, or medical group? And finally, which plans, health systems, or doctors would help me obtain a state of complete physical, mental, and social well-being and not merely an absence of disease or infirmity? Now, if we're going to go to the year 2043, and we can't even answer these questions, what assumptions must you have about year 2043? The first is humans will exist. You've heard a great deal today that could argue that humans will not exist in the year 2043, and we'll have a new species of man and machine, which will not be what we now call a Homo sapiens. Second, most cities will not be underwater. This conference is going on the same week. The climate report was released, and a hurricane is bearing down on the panhandle of Florida. Do you believe this assumption? Third, women will not be immortal. Therefore, men will still exist. If you're immortal women, you do not need men. Why will women be immortal and not men? Because women have more chromosomal material than men. So if you're going to immortalize anybody, it will be women and not men. Now, people will visit the virtual world. You've heard a tremendous amount about virtual reality, but we'll spend at least some time in the real world and be able to tell the difference In 25 years, will we want to spend any time in the real world at all? Or will we spend all of the time with our avatar in a virtual world and we will not care one iota about the real world? Now, things a little bit more realistic. Will Democrats and Republicans will actually work together? Because these are big issues and we have to solve some of them. 2, health insurers and physicians will like each other. Wouldn't it be nice if these two groups of people actually liked each other and really worked together? Physicians will treat nurses with respect. There'll be no wildfires in California. I come from California. It's October. You really get worried in October in California. Now, imagine tolerance as a part of future well-being. Let's talk about a few thoughts about the human race when we imagine this. I don't know how many of you have read *Sapiens* by Yuval Harari, but he postulates that we have become godlike. I have been here for 3 days, and I've heard so many amazing presentations that I already believe we have become godlike. We are undecided about what to do as a culture or as a race. We are dangerous because we're undecided. Here's another thought experiment. Do you think we're mature enough, we've made any progress? Let's say we tore up the Constitution of the United States and rewrote it today. Do you think we can write a better Constitution than we had before? Now, I wrote a little piece of an article in JAMA. You can get it, and if you can't get it, you can always email me. I'm old-fashioned because I'm old, at robert_brook@rand.org. And I said that no community or nation should be considered healthy if hatred is pervasive, nor should any individual be considered healthy if he or she is intolerant. Do we believe that medicine and public health needs to step up to the plate to redefine health and use this definition? It would change the countries on all those graphs you saw over the 3 days that were ranked as those that were the healthiest, either with the longest life expectancy or the ones that had the highest functioning population. It would change that if we added this to the definition of health. Now, to do this, there will have to be some investment, teamwork, and research, because we don't know how to do this. We don't know how to train physicians, nurses, and health professionals how to do this. We have no idea how to do this. It wouldn't take a lot of money compared to the amount of money that's going into some of the things you've heard about, but we'd have to invest money and time to figure out how to do this, how to measure it, how to develop training materials, how to develop interventions, how to do policy changes, and how to make this part of the leadership of medicine and public health. Now, here's a start, a very simple start. What if this sign was posted every time you went in to see a health professional, or maybe every time you access Facebook for a health app or a health piece of information? Being healthy requires being tolerant. We are here to help you broaden your mind. Please ask. I'm going to stop and tell another clinical story for a second. One of my friends is an oncologist. He was infusing chemotherapy into a woman with breast cancer. And he has a habit of sitting there when he does that. And while he was doing that, the woman said, "I've written my daughter out of the will." And the doctor said, "Why?" And the response was, "She's a lesbian." And the doctor, while he was infusing the chemotherapy for the next half hour, tried to convince this woman that she should not write her daughter out of the will because she was a lesbian, but she should consider whether she was a good person. At the end of this, he came to me, we were out, and talked to me and said, "Did I do the right thing?" I said, "I don't know. We don't know the answer to that. We don't have any evidence about how doctors and nurses should approach the issue of increasing tolerance in our society." Now, there are two ways to improve health. There's one is basic science, which you've heard a lot about. Maybe artificial intelligence, machine learning, but that's all basic science. The other is to eliminate social determinants. So you could think about a tolerance pill. What if we put billions of dollars of money into a pill that improved tolerance, changed the makeup of the human brain, and made us more tolerant? Like we put fluoride in the water to eliminate dental cavities. The other option is to try to eliminate the social determinants that a lot of people have talked about today and the last 2 days. However, if you don't believe either one of them will get at the root cause of eliminating tolerance, then some set of professionals are going to have to step up to the plate and try to change the culture of the human race. My argument is that doctors and nurses and other health professionals and public health people need to do that. But I may be crazy. Now, be humble. It's not about you. It's about your grandchildren and your children. It is not about you. We can't save this planet without liking each other and working together. We could, hundreds of years ago, wipe out a sixth or more of the population and recover. We just simply have gotten to the point where we can't save this planet without liking each other and respecting each other. While we are changing the paradigm of healthcare, we can still take meaningful steps today. So I'm going to just end this conversation on a few simpler things that we can do while we are trying to get to the year 2043, when we will all be much more tolerant than we are today. First of all, I think you should not use a whack-a-mole approach. A lot of response to change is what that game whack-a-mole was. Somebody has a good idea, and we go for it, and then another mole pops up, and we whack that one. We've got to do a lot of things simultaneously. I'm going to give you 5 or 6 things at the top of my list. We should right now, and Minnesota would be a great place to start, evaluate all policies, local and national, on reducing variation in health. We do virtually none of it right now. When a law is passed, a regulation is instituted or removed, we know very, very little about its effect on whether it's going to increase or decrease the variation in health as a function of who you are, gender, color, race, where you live, your educational status. We can do this. We have all the tools to do it, and you've seen with big data and all these other kinds of new advances with AI and everything, it should be easier to do this than it was in the past. We should change the definition of health to include love and kindness. What if health, we even went that far? We should incentivize employees not to improve their own health. You get much healthier when you improve the health of strangers. Think of your dog, for those of you that have a dog. When you look into the eyes of the dog's oxytocin goes up and he wags his tail or she wags her tail. You do the same thing. Your oxytocin goes up as well. When is the last time on a daily basis anyone incentivized employees not to write checks and do big things, but actually on the ground level to improve the health of strangers? The C-suite compensation should be tied at least a little bit to improving the health of the community in which the organization exists. What if we just flat out said, your compensation in the C-suite is dependent on improving the health not of just the 9 square block area you live in, but the health of the entire community in which you are a resident. For that matter, I've argued over and over again, a hospital cannot be labeled as the best hospital in the United States unless it takes its fair share of Medicaid and underinsured patients. Should not be labeled that way. Now, we got to bring education and healthcare together. We can do some of it simply. Help schools provide feedback to parents on a weekly basis. We have learned through studies that no matter how much schooling a parent has had, if you give a parent information about their child's performance, did they miss school, did they not turn in an assignment, did they flunk an assignment, on a weekly basis, you could dramatically improve the school. It's a very simple thing. With all the advances you've heard today, we should be able to do that tomorrow. Insist children bring their report card to their physician, or whatever substitutes these days for a report card, and have the doctor say to the parent and the child, you know, what I'm doing today and giving you the vaccination and talking to you about your health is important, but the thing that is most important is how you do in school. And let me just spend 1 minute of my precious time looking at your report card and telling you I really mean it. It would be a very simple intervention to do. Make the environment safe. We are obese because we have an unsafe environment, not because people are weak. Let me repeat that. We are obese and that we have a diabetic epidemic, not because people are weak, but because we have an unsafe environment, which has even made the strongest people in the country heavier than they would like to be, or have higher blood pressure or cholesterol than they would like. We can work together to eliminate sugar. One of my colleagues at Rand, who is a doctor, said that when she went to medical school at the University of Pennsylvania and walked from her apartment to the medical school, there were only 4 places she could buy any kind of food. She just repeated the same walk. There are now 54 places that she can buy the same food. We could eliminate tomorrow. We tried to do this 30 years ago in the state of Washington. There is no excuse for paper billing and utilization review prior to delivery of a service. There is absolutely no excuse, and it removes trust when people receive hundreds of thousands of dollars of bills, and after months of fighting, the thing is settled for $20. It looks like you're in a mafia ring when you do that. We can eliminate all of this. It's not going to cost us any money and probably will save money, and we know how to do it. And finally, I'm going to close. We need to do all this with communities as equal partners. One of the greatest satisfactions when I ran the RAND health program was taking my most esoteric and statisticians with more PhDs than God had PhDs into the inner city of Los Angeles and say, your job is to explain to these people what is this study that we've just done, why it is important to them in a way that they could understand it and tell it to other people in the community. They first looked at me and said, or wanted to say, you can't do that unless you have 15 years of mathematical training. And I said, I bet you can do it. And they did it. And for the last 15 years or so at UCLA and Rand, a large percentage of everything we do with a community partner. And when we present the results, we don't get up and when we present the results, we don't have the community partner introduce us and then we present the results. Rather, we introduce the community partner and have them present the results. If we really want to make change and we really want to survive for the next 25 years so there can be a Manova conference in the year 2043, got to change our culture in regards to tolerance, and we got to do it in full partnership with our communities. Thank you very much.